My name is Laurent Willemot, and I am one of the junior consultants here at the Launceston General in the Department of Orthopedic Surgery. One of the frustrations we have with dealing with athletes and their ACL reconstructions is that in the immediate post-operative phase, we can see their muscles melting away. And it's very frustrating to have done a technically demanding surgery and then watch the muscles fade away as we wait for our procedures to heal up enough so that the athlete can function again. Especially here in Australia, but in Tasmania specifically, there's been an explosion of adolescents and young people getting into contact sports, netball and football. And so we see a lot of these knee injuries, ligament injuries that need surgery. And so one of the things we're trying to battle is trying to get their muscle volume up during the early rehabilitation phase. It's a technique that originally came from Japan, and I think one of the physiotherapists there found out that if you tied off a limb and then exercised it and got venous congestion, so it kind of bulges up and all the veins bulge up, it helps promote muscle growth. And so this then has been applied in lots of areas, but it could be very useful for us because it means that without actually exercising as heavily, you can get the same muscle regrowth. And so while our patients are recovering from the surgery and they're not allowed to do heavy exercises, they can still stimulate their muscle growth. It's all over YouTube and the internet and TikTok and people promoting it, but that obviously doesn't mean that it definitely works. And there's been studies showing it does, but there's been an equal amount of studies showing that it doesn't. And so the idea behind this study was to at least start a pilot to show that we can find evidence for it working, objective evidence, not just the subjective stories. And if this works within our expectations, that is to then have a larger scale implementation of blood flow restriction as part of the general rehabilitation routine. This is also why we're very excited, because thanks to the funding, we can do it properly compared to other studies, and that would include having a randomized control trial. So we have two groups of patients, and in contrast to some other studies, we don't have half of them getting the treatment and half of them not getting treatment, but both groups would be getting this blood flow restriction treatment, but one of them, or one group, would have a fake regimen, and so they would get some of the treatment but not really apply it as to the proper protocol. And so they would be thinking that they're getting the same treatment, so there's no bias, and then we can actually measure whether it's the blood flow itself that's causing the muscle regrowth, or whether it's some sort of placebo effect because of the heightened attention to the physio. Fortunately, a lot of what we do in medicine is based on experience and not so much on evidence, and this is something that we can verify and that we can implement if it works, and if we can scientifically prove that it makes a difference. And on the other hand, it's something that is quite expensive to do and takes up valuable physio time, and so if we can prove that it works and it has benefits, then it's something we can spend public and private money on. But if it doesn't work, it's definitely something we should try to debunk and stop from costing patients and government money without any additional benefit. Well, so one of the things that is frustrating is that these both amateur level but professional athletes as well, is that we do a successful procedure by all measures and imaging, and then somehow the athlete doesn't get back to their former level of performance, or it takes a very long time before they get there, 9 months, 12 months, which could be career ending in some cases, or frustrating enough so that the person stops their sports. And so the idea would be that if this shows remarkable effect and leads to quicker rehab and quicker return to sports and higher level of sports, that this would become part of the general physiotherapy protocol and just becomes commonplace, and helps preventing those long delays in recovery. And I think orthopedic surgery lends itself very well to very clear-cut studies, and I think it's still putting Launceston on the map in the area of orthopedics research, Australia-wide and internationally in some studies. And so we'd like to continue that tradition of having well-structured, well-organized, well-funded studies that make a difference.